All right, welcome everyone it is July 10th, 2:34. And we're about to start our Health Equity Committee meeting for the city of Norwich. I'm your chair, Joe Zuzel, and I am present. We're going to go around the table and have everybody do a roll for attendance.
Mohammed Qureshi,
Jen,
Jen Granger, UCFS.
Laura. Oh, you're muted, Laura.
Laura Dietrich, Norwich Public Schools.
Chief Daly,
Pat Daly, Norwich Police.
Kate,
Kate Mildy, Norwich Human Services.
Patrick McCormick, Uncas Health District.
Bella Hayes, NAACP.
great. And we're a simple majority, so we have a quorum and we can move forward. So my first order of business is I would like to propose a motion to accept the minutes from the June meeting as presented. Can I get a motion on the table, please?
Patrick, I'll make a motion.
Okay, Patrick McCormick moves. Second, please.
Patrick Daly, second.
Chief Daly seconds. All those in favor?
Aye.
Aye, raise your hand, please.
Don't you have to do roll call?
Oh, I'll do roll
Aye.
call. Yeah, sorry. I'm roll calling. Okay, here we go. Jen Granger, UCFS.
Hi.
Mohammed Qureshi, Hartford Healthcare.
aye.
Laura Dietrich, Norwich Public Schools. Oh, you're muted. Sorry.
Aye.
Chief Daly,
Aye.
Kate Mildy, Town of Norwich.
Aye.
Patrick McCormick, Uncas Health District.
Aye.
Joe,
Sheila Hayes,
aye.
Joe Zuzel, aye. Motion passes unanimous. Thank you very much. Minutes are locked in. We'll move on to agenda item number 4, updates. This will be a standing agenda item moving forward. We'll do chair updates first, and that will be me. So we're going to talk about our meeting cadence to start with. So moving forward, we're looking at how often we are meeting and when we are going to meet. So we're looking at the 2:30, 3:30 meeting for now. Does anyone have issues with the cadence times that we're meeting? I'll open it up for discussion.
I would suggest maybe a different time only because the city manager is always at agenda setting during this time, so he can't come to these meetings.
Do you know what time agenda setting is usually done on Monday?
It can drag
No,
out.
I don't. Sorry.
Okay.
But I can find out for you.
Okay, that would be good to find out when that happens. Also, with the request for a recording secretary, we're looking for best timing for one of those as well. So that's something we'd also want to keep in mind. Any other opportunities for meeting cadence?
So it's always going to be the second Monday for the city manager. So if we move it to a different Monday,
At the same time,
does that work? Well, we don't know about
right?
the recording secretary.
But around the same time. is what
But-
you're
Well, that's what Jackie was sort of
alluding to.
alluding to, that some of the people, once their kids, well, they're back in school, so they're not out till 4:30. Some recording secretaries, when the kids come home, it's an issue. So the question might be, is it even possible to move it up?
Well, let's take the topic of just when the cadence is on Mondays. If we were to change from the second Monday to like the first Monday or so on and so forth, are there any major issues from the quorum right now? Hearing none. So that's something that we can entertain moving forward.
So Joe, just to clarify,
Sure.
it's gonna be the same time though, right? On Monday?
So we're looking into that right now. So our request for the city to provide funding for a recording secretary, we'll get to that update later on in the report. but it looks pretty favorable for us. The only issue is we need to find a way to have that individual fitted into their schedule this meeting. So that could be the only wiggling that we would need to do specifically for that time. So right now, we'd just like to figure out if there's a way we get the city manager involved in these meetings, and then we'll sort of look at the time as we get more clarification on the recording secretary. Other questions about that? Okay, perfect. And then just in terms of chair updates, so the Health Equity Committee semi-annual report summary is due by 9/30/23. So we'll just stand on there as a reminder to whomever decides to chair, and as a group that we should be having product that we will be able to share at that upcoming report. Any questions on chair updates? All right, moving forward. Subsection B, Kate Milley, Director of Human Services. I'll turn that over to you, Kate.
Sorry, it takes me a minute to mute and unmute sometimes.
But all right,
Driving.
I also have your email too, so if you permit me to read the responses to the agenda questions from the email, I can do that too if it's easier for you.
That's brilliant. Thank you, Joe. I would super appreciate it.
Okay, so let it be noted, Kate is giving me permission to read her responses to her updates. All right, so in terms of item I, clarification of voting members by organization. So Kate writes, I am a full voting member and my temporary role in assisting with the launch of this committee has ended. Chairs will take over administration and the city will find a recording secretary. I can forward this language to you as well. In regards to asking about other city employees, they are all also full voting members. And Kate, please interrupt me if I do not say anything correctly or you need further clarification. So that's
You're
wonderful.
doing great. Thanks, Joe.
So that's wonderful. We now have all of the members of the committee who are full voting members, which is something is really important for us, and especially since we've had quorum difficulties in the past. So that's some great movement forward for us. In bullet point II, Health Equity Solutions report. So the Health Equity Solutions, the idea that there is some report that was created. Sorry, phone is messing with me. Came from an email stream that was misunderstood. They simply do the type of work that HEC aims to do and might be a good guess. So Health Equity Solutions never actually completed a report. They were there as a full consultant. I do believe that we paid them a fee, however, so I wonder if that's just a retaining fee.
We did pay Demographic Perspectives a fee really early on, just to kind of help us find some direction. That was before I became director, and then we terminated that. We'll put that contract on hold effectively. So this Health Equity Solutions was just another entity we discovered that can kind of, like you said, consult on these topics and does the similar work. But the Health Equity Committee hasn't actually paid them or engaged with them yet at all.
Perfect. So Health Equity Solutions was another consultant that we were interested in working with and not Demographic Perspectives. Is there supposed to be a report from Demographic Perspectives?
No, because we never had any actual work get done with them. So we ended up having to pay a nominal fee for like meetings and setup, but then you know, the Health Equity Committee didn't really have a direction, so we put everything on hold. If you guys want to re-engage, we have that PO open and that contract can be revisited.
Okay. So as it stands now, Demographic Perspectives, we're no longer in that relationship, so we do not need to engage in that conversation unless we choose to. Health Equity Solutions is there only as an option for us in terms of a future consultant. Any questions or comments on this agenda item? Observations? I'll open it up. Okay. As some of you know, we are working together to compile health equity data that the Health District, Hartford Healthcare, Generations, and UCFS has all collected for the community health needs assessments. So I continue to believe that that is work that we should sort of move forward and look at before we engage a consulting partner. But I'm open to hearing any
We could-
feedback in terms
This
of
is
that.
Patrick. I guess it just begs the question, is there a budget item that we need to move to something else to make our work move forward, or so would it be helpful to have a consultant do some of that data collection for us or compile the data, or would it be, sounds like we don't need to use it now for the note taker, minute taker person.
Right.
But there, if there's money available, maybe there is a purpose for that funding now that we could use it. Possibly curious.
Possibly. I'm not sure how that money is allocated. Also, since we do have a standing relationship with Demographic Perspectives.
Okay, thank you.
Okay, I'm sorry, Kate.
Yeah, so that's an interesting question. Demographic Perspective, that PO was opened under my department's ARPA funding. So it was, in my opinion, misappropriated, and my department somehow was on the hook for that erroneously. So my department did pay out of ARPA funds that $1,500 already out of Demographic Perspective, but I would counter that we should not have to foot the bill for the entire committee on any consultant fees moving forward.
Makes sense.
So that being said, it sounds like there is no budget that exists for that purpose.
I don't think so.
Okay.
That's
all right.
correct. You're
Just-
absolutely right. Yep.
So, once we can actually present the data, which would be our next sort of step in terms of figuring out where we are, then we can basically decide what to do with it. I think it's just important that we actually be able to present it. We haven't because of previous issues with quorum.
It's just nice to be able to present it in an organized fashion as
Agree.
opposed to just dumping a bunch of data
I agree.
at the council. or whoever.
That being said, if individuals know of folks who would be willing to do that and kind of organize data, we do have that data that's available. So let me know. All right. Any other questions, comments about Demographic Perspectives and that data for health equity solutions?
Joe, I'm just thinking loudly, and tell me if I'm inappropriate in the sense. But from Three Rivers, there is a summer break. Many students are looking for internship opportunities. Is there an opportunity to engage somebody from the college who looks at data analysis and see if they can give us a couple of months and internship experience, and then look at the data that we have and put it together for us?
I think that's a good idea. How do other people think about that?
Sure, I'm fine with that.
Yeah, this is Patrick. I was actually thinking the same thing. I just knew the deadline for September 30th is difficult. So if there was a way to, I guess the report could be that we have an intern that maybe, or a student that might be working on the data, that could be part of our report.
Any other questions about that, comments about that? Does anyone have a good connection at Three Rivers in terms of their volunteer connections?
I'm on the board, Joe.
Oh. Is there
Oh, sign me
any
up.
way, Kate, that you would like to reach out?
Sure, yeah, you can go ahead and assign me that.
Okay. Can I have a motion to reach out to Three Rivers to look for a student who would be willing to analyze our current health demographic data? I just slow it down.
I'll put that motion forth.
Yeah, change it up, please.
A motion to authorize Kate Melby
Yes,
to now go, that's all.
to reach out, to
To
contact Three Rivers,
Well, it's not called Three Rivers anymore. So,
TRC.
no, they changed it as one community college.
Connecticut State
College.
College at
Connecticut State
Connecticut State Colleges.
At the TRCC campus,
Campus.
or whatever, I'll look it
Yeah.
up officially. At the campus to engage
A student,
an intern,
sure,
a student intern.
Yep.
Go ahead.
interested in compiling health equity data
On behalf of the community.
on behalf of the Health Equity Committee. Thank you. I didn't want to name every single. Can you read the motion back, please?
And, motion to authorize Kate Milby to contact Connecticut State Colleges at the Norwich campus to engage a student intern interested in compiling health equity data on behalf of the Health Equity Committee.
Okay. Can I get someone to entertain that motion, please?
The Mohammed Qureshi.
Dr. Qureshi, a second, please.
This is Patrick McCormick. I'll second it.
We'll do a roll call for votes. Jennifer Granger,
Aye.
Dr. Qureshi,
Aye.
Laura Dietrich,
Aye.
Patrick Daly,
Aye.
Kate Mildy,
Aye.
Patrick McCormick,
Aye.
Sheila Hayes,
Aye.
Joe Zuzell, aye. Motion passes. We're moving along. Great work, folks. Moving on to subset III, the amended resolution, the red line changes from changes made at the June HEC meeting. So Kate has provided us with copies of these. I'll pass them out here and then we can send them digitally if you have not received them. The front page is the resolution as it was. I'll just read the changed red line amendments in the back out loud for those who do not have it in front of them. So now therefore be resolved by the Council of the City of Norwich that a Health Equity Committee be and same hereby is created to consist of the following persons or representatives of organizations, all to serve for 2-year terms ending October 3rd, 2024, or until successors are appointed or the committee is dissolved. 1, city manager or representative. 2, representative of Uncas Health District. 3, representative of the Norwich Police Department. 4, representative of the Norwich Department of Human Services. 5, Director of Human Services, her, their successor, or representative of the Norwich Human Services Department. 6, a representative of the Norwich NAACP. 7, a representative of United Community and Family Services Healthcare. 9, a representative of the Otis Library. 10, Representative Hartford Healthcare. 11, Dr. Alexander Mbiwe, or a representative of Hartford Healthcare. 12, Director of Community Health or a representative Hartford Healthcare. 13, Chief Executive Officer or designee of Generations. 14, Norwich Public Schools Director of Equity or representative. I'll open it up.
Question I have to Laura. Will we still have the title of Director of Equity, or should we just say representative of Norwich Public Schools?
So Sarah Dusso was the Director of Equity at Norwich Public Schools. I am the nursing supervisor there. And she asked me to join in her place, so I don't believe she will be here. I can
Nobody's-
clarify.
I think in terms of clarification, we're just wondering if the Director of Equity is still a position that should be listed in the resolution, or it should just say a representative of Norwich Public Schools.
I would put it as a representative of Norwich Public Schools.
I second that.
Well,
Well,
we haven't had a motion. I think
we're
just
not a
saying-
motion. We're just discussing now. But here's what I'll do. I'll put a motion on the table to accept the changes. I'll ask for a motion
Well,
to,
what you're
and
gonna
then we can
change.
do
first-
we can do discussion and make the changes in it, right?
No, yes, well, you don't need, then you could just do a motion and we just change it.
All right, so we're just
We're
gonna
gonna do-
discuss first. We're gonna do it. We're gonna
Well,
do
just
this.
agree to change that
Okay.
one, I think.
All right, so can I get a motion to change the wording from Norwich Public Schools Director of Equity or Representative to Representative of Norwich Public Schools?
So moved.
Second.
You want me to say it again?
No, I don't.
Oh, wait.
No, go ahead.
I gotta slow down.
know it's in
Okay.
my head.
All right,
It's
good.
in my head.
Okay, good.
Who was the first? Was that?
So I
you?
got Kate as a moved, and I think Laura as the second.
Jen.
Jen.
Yeah,
Jen is the
it's-
second.
It's sometimes names that I can go back and get them all.
All right, good. Roll call again. Jen,
Aye.
Just so you know, we are recording the meeting, so
Well, that's good. Dr. Qureshi,
Aye.
Laura,
Aye.
Chief Daly. Chief,
Sorry, muting issue. Aye.
Kate,
Aye.
Patrick,
aye.
Sheila,
I,
Joe Zuzell, aye. Motion passes unanimously, so we will have that changed.
Joe? So
Yes,
could you reread the UCFS line? Because I think it had,
sure.
just reread it. Let me hear it.
7, a representative of United Community and Family Services Healthcare.
So just United Community and Family Services, no healthcare at the end, just because it's not our official corporate name.
Got it.
Thank you.
I don't have to vote on that.
Do you need a motion to do that?
No,
No.
no.
Correction,
That's a personal change. I'm fine with that.
That's just a correction.
It's like me spelling a name wrong.
Can I
Yeah.
just- Can I just ask a minor question?
Sure.
So when it's Dr. Qureshi, or Dr. Mbiwe, it says or representative of Hartford Healthcare, so is Dr. Qureshi representing a specific part of Hartford
So
Healthcare?
Dr.
or-
Qureshi is in red, so I think Dr. Mbiwe is the only one who's named specifically on this one.
I'm just thinking it's redundant to say a representative, because there may be 2 representatives of Hartford Healthcare, there, that kind of thing I didn't know if they're representing a specific portion of Hartford Healthcare or.
Yeah, I mean, they
So
represent-
Dr. Mbiwe is a geriatrician with specific, insight into the community needs of elderly providers. And, so I think he brings an extra, expertise in my opinion.
I guess should we say
And
up
as
to,
chief
up to,
hospitalist, Dr. Qureshi is the hospital connection and I'm the community connection.
yeah, I just
So
didn't,
and my title is the hospitalist department, so I constantly see the inequities in our community when we see the patients in the hospital.
so, or should that say, or a representative of the hospitalist?
correct, yeah.
You
I know what you're
they're-
getting at.
Right, that should we put in their specific areas, that is just not a representative from the Hartford Healthcare.
Yeah. Makes sense to me.
Do we want to specify Hartford Healthcare East Region or anything more specific to like the Norwich area, or is that not necessary?
I'll put that out to the group.
I mean, you know Hartford Healthcare better than I
Right,
do.
that's it, yeah, I
Yeah.
just think it's a wording change and
I think
we get
would-
it from
I
your
think we would- we
recommendation.
would be fine.
Okay.
So do you want to vote on changing specific areas, or since
Yeah.
we've already have the 3, we'll just put clarifying language
Right,
in
I
there
just
from where
think
it
we
comes
need to
from?
put clarifying language.
Okay, so that's something that we'll add. Good work. Other questions on the red line resolutions changes? Any other comments? So we voted to accept these beforehand, so we're
No.
gonna send them back to get changed and then vote to accept them again? How does that work?
We didn't vote to accept them, I thought we voted.
To bring them forward, to get changed. Right?
No,
To
there
bring
was
to
a
the city
motion, yeah, this, yeah, if you go back to the, you're talking about last month,
Yeah.
a motion to gain clarification of voting members, a motion. That's. Motion to accept red line changes, but we didn't do anything with that. So we need to now make a motion to accept the updated.
Okay.
The amended,
And then bring it to the council.
and then a motion to forward that
Yeah.
to the, Kate, help me with to forward it to the city manager. I think if these would have to come from the city manager now,
So the-
because they gotta go into agenda set.
okay,
And I think we'd have to send them through him.
okay. So just in the interest of time, can we change 10 to hospitalist, a Hartford Healthcare hospitalist or representative of Hartford Healthcare?
Mhm.
And then can we also say a help me out, Dr. Qureshi, like an outpatient doctor? How would do that?
Say that again, Joe?
So I want there to be a hospitalist from Hartford Healthcare, and then in terms of Dr. Mbiwe, I want it to be an outpatient
Yes.
physician. So we would say an outpatient physician.
So
Is
we
that
would say, right, we could say that.
Okay, so that would say outpatient physician and then director of community health or representative stays there.
Right, so you're gonna take this with the amendments and send it to Kate.
Yep,
So, I mean, because we're not gonna vote on those.
we can't
those-
vote on
We
it.
don't need to vote on the organizational,
Right,
just for clarification.
okay,
Okay. But we need to vote on how we've amended
okay.
this now.
So can I get a motion to accept the red line changes as amended?
It's Patrick,
And Mohammed Qureshi, this is the motion to amend the red line changes as presented.
Right,
Patrick second. McCormick.
okay. Roll call, Jen,
Aye.
Dr. Qureshi,
Aye.
Laura,
Aye.
Chief Daly,
Aye.
Kate,
Aye.
Patrick.
Aye.
Sheila,
I,
Josie Zell, aye, motion passes. Do we now want to move it to the town manager?
right.
Can I get a motion to send the red line changes, the accepted red line changes to the town manager,
City manager.
city manager?
It's Patrick McCormick. I'll make a motion.
Patrick moves. A second, please.
Mohammed Qureshi, second.
Dr. Qureshi, second. Roll call, Jen.
Wait a minute, can we amend that for a moment?
Sure.
A motion to remit, wait a minute, so down. Motion to remit the accepted red line changes to, we need this is one we need to of the resolution, a motion to remit the accepted, we approved, it's actually, because we approved them now. For the accepted red line changes to the health equity, is that what that was, the health equity
Mhm.
resolution? Health equity resolution dated October 3rd of 2022 to the Norwich City Manager. For consideration for council adoption.
Great. Can you read it back one more time,
Okay,
please?
a motion to remit the accepted red line changes to the health equity resolution dated October 3rd, 2022 to the Norwich City Manager for consideration for Norwich City Council adoption.
Can I get a member to make that motion?
So moved, Jennifer.
Jen, second?
Second, Pat Daly.
Ready?
Mhm.
Roll call, Jen,
Aye.
Dr. Qureshi,
Aye.
Laura,
Aye.
Chief Daly,
Aye.
Kate,
Aye.
Patrick,
Aye.
Sheila,
Aye.
Josie Zell, aye. Motion passes. Moving forward with that, getting a lot of things done, folks. Appreciate all your time with this. And then subsection 4, IV. My phone is blocked out here. So we were approved budget allocation for the recording secretary for the Health Equity Committee. So right now we are trying to figure out whom will be taking that position and when we can put them into place. So we really appreciate Kate, you and John's support in that. Because as we are seeing, there's a lot to be done from the recording secretary side, and thank you, Sheila, for filling in the meantime. Any other questions, comments, concerns about that specific bullet point?
So Joe, do we know what's the amount?
Oh, I would have to dig into that unless Kate, you have that offhand.
That's,
I do not know the amount, but I can get an answer for you. It won't come out of any budget allocation from any of our departments. It'll come out of the city manager's funding this year at least.
okay.
So doing a quick search, I don't have that, so. All right, any other comments? Hearing none, we move on to agenda item number 5, our guest speaker. I'd like to introduce Kevin Brown, President of Norwich Community Development Corporation, NCDC. And we'll start with our first bullet point here. The Health Equity Committee leading multidisciplinary conversations regarding educating, regulating, and understanding legal cannabis use in the city. You have the
Okay.
floor.
Thanks. I think I sort of stumbled into this committee by virtue of those Friday legislator calls, which were initially were started because of a public health emergency with COVID. And the longer I was on those calls with what is essentially this same body, plus or minus a few folks, the more it dawned on me that this same group of folks ought to at least be giving some consideration to whether or not the Health Equity Commission has a position or a place or anything in the dialogue. It is a multidisciplinary matter, right? It's not a public health emergency. The cannabis industry is not a public health emergency, but the cannabis industry is a public health matter. And, you know, I go across this list of members and I see city policy, health, regulation, youth, children, families, you know, and health matters, right? So it's this group of folks. We have, as NCDC, done the economic development chase and landed 2 cultivators and a retailer here in the town of Norwich. Potentially one more of each of those might come. Now that the chase is over, the reality is beginning to set in my mind that we have to be, as a city and as this, perhaps this multidisciplinary group, and I think that's for you guys to consider. I looked ahead on your 6 areas of focus, and I couldn't find one place to jam this conversation that I'm bringing to you into. But somehow I think this conversation needs to make its way into this committee. If for no other reason, well, let's go with 2 reasons. One, the social impact. Whatever it is, there's going to be a social impact in our town. And this body will, if it doesn't proactively converse and think about and decide and offer solutions to things, it will ultimately potentially end up reacting to things that we figure out down the line. So there's the social side. And then there's the very pragmatic dollars and cents side. Today, the report was released that in these first 6 months of the legal retail sale, Connecticut is at 122 million in sales for the first 6 months, and that's with only 10 or 12 retail facilities. If I just do some back of the envelope math, that says that those municipalities that currently have an operating retail facility stand to net as much as $700,000 in municipal tax revenues from the retail facilities in their towns. Norwich's opens on Friday. The grand opening is on Friday. Those dollars, those municipal tax revenue dollars, it's 3% of all gross sales. We will accumulate and aggregate until the next budget year for the city is put together. So in April timeframe, the controller and team will start to look at what has been rolling in over these next 6 or 8 months, forecast it out, and allocate those dollars that have come in. Conservative estimate, the city of Norwich will probably net $350,000 in municipal tax revenues from the sale of medical and recreational cannabis in town. Those money's got to go somewhere. And now I'm back around to where if the social impact thing is too amorphous for all of us to kind of wrap our head around and get ahead of and say, hey, we need to create this committee or that thing. If we have to wait and see what happens before we can figure that out, what we at least know is we're going to have some, we are going to have some dollars in our hands that have, and I'll read them off for you.
Let me just pause you on
yes,
the funding
please.
part, because I
Yep.
want to open it up to the committee members
Right on.
about your first point with the multidisciplinary conversation.
Got it.
regarding education, regulating, understanding legal cannabis. I'm going to open it up to the committee for comments. Let's talk a little bit about this, what our role is, what we're looking at, questions that you might have for Kevin Brown.
I think this is Patrick. I think we're McCormick. I mean, obviously, we're not the first state to take this on. In Massachusetts, our neighbor to the north has taken this on 2 years ago. Was it 2 or 3 years ago? So I think, it'll be interesting to see what data they've collected. I mean, I haven't done a deep dive in any of it to see where the impacts are and how they've responded to those impacts. I think there's lessons to be learned from other states that we could at least consider as we start answering some of these questions. I don't know if you've looked into
No,
some of that information.
I can only say, Patrick, that, like any of the rest of us from a casual reading standpoint, I'm staying up on these things, and I don't mean that I'm coming here to drop this on you guys, but my role in this is to pursue the economic opportunity, and I've done so. So now I'm here to hand off, right? I'm saying that half kiddingly, but I depend on the expertise and the environments that each of you lives in that could drill down on how it would impact your particular piece or part of this matter of health equity. And then just having said health equity out loud, it reminds me too that part of the way that this committee came to be, I think it was early in my tenure at NCDC, was looking at the imbalanced impact of COVID from an equity standpoint, right? This conversation, this cannabis conversation, as many of you know, has social equity wrapped around it as well, because there are portions of our population that were disproportionately impacted by the illegal situation that cannabis was, that it no longer is. And part of it is to help the disproportionately impacted community rise up in any number of ways, whether you look at it from a dollars and cents standpoint or just the social impact standpoint. So I know all these things I'm telling you. I don't have a trove of information to answer to them. And I think this is just an introductory conversation to say we should be kicking this around and figure out what we.
So I guess I have a question in terms of, we know that the governor has put specific language in for retailers and cultivators in terms of trying to address some of those, social issues that have happened over the years. What is the responsibility of these individuals who are coming in? What are they looking for? Because we're really interested in not duplicating our efforts and making sure that we are adding to and supplementing work that's already being done versus reinventing the wheel.
Right. I don't think, if you look to the operators, you're probably, and I'm speaking completely candidly here, you're probably not going to see much more than just what's required of them. In other words, filing a social equity workforce plan that says words to the effect of best efforts to hire people from the population that was disproportionately impacted. And there's the business side, and there's the municipal side.
Yep.
And they are not stepping over that line and saying, you know what else we're going to do? You know what other extra thing we're going to do? We've pulled them, Sheila, thank you. We've pulled them to that line, and they're engaged with the NAACP, Global City Norwich, Lead Mosaic, agencies that have a social impact, and each of them are trying to pull them across the line. But right now, Joe, to answer your question, they're just meeting the minutes. They're doing what they're supposed to do. Now, the other part of this conversation, I know you stopped me before I got into the dollars and cents of it, but the rest of the story is, by funneling those tax revenues back to the municipalities, the idea is that we use these monies in the appropriate way, that we can make a difference on any number of fronts, hiring a recording secretary for this committee or whatever, whatever those things might be. That's where we begin to put dollars and cents and pragmatically do something. If you don't mind, let me just read off the six categories.
Please.
Just before you go into your 6 categories though, but in fairness, at least to the one retail company that I have been engaged in, and I owe them a response. She's been good with that. In fairness to them, that they're new to Connecticut, new maybe even to the area.
Right.
Okay, so there's a lot of unknowns about who we are, as they are unknown to us about really what their goals are to achieve.
Mhm.
Okay. So I looked at it and what Kevin was saying is that they may have wanted to do the bare minimum, but we pushed the needle to say, no, here's programs or areas that we specifically want addressed. And now this is how we want them addressed. And so that's the next
The
email back
ongoing conversation.
is
Yeah.
to say, how are we going to engage them to do it? I mention that because I really think that with this committee, with the organizations who are part of it, who may not be in the advocacy or social equity fight, but from the healthcare side, once we know what that data looks like, okay, that we can start to frame it for them. Okay, here are the healthcare impacts that are high affecting our Eastern Connecticut. Okay, and then how do we develop a relationship to address that? We'll address it, obviously, what Kevin's going to get into through the funding side, but how do we engage them as a corporation company?
Mhm.
How do we engage them, whether it's through a marketing campaign, we do a real health fair around some of the issues, because smoking is smoking to me, whether you call it tobacco or cannabis, there's still so I think, and in my understanding, and only because I have a little more knowledge because I've been engaged with it on the NAACP, is we have the opportunity to create the framework to say to them, this is the benefit, this is the relationship and the partnership, and here's the areas we want focused. The funding part, which is Kevin's going to get to, because we're not going to see that for a year.
Right.
I'd like for us to focus on how to engage them. And then when the funding becomes available, that's how we get the city to recognize the benefit of some
Support
of
those
that
programs.
funding. Okay, thank you, Kevin.
Well, I sort of a natural progression through
Yeah,
the
that's great.
agenda here. So, and Kate, I'm reading off the chart that you created for us. Thank you, but I will not discuss any of the pre-decisional allocations of dollars that you carved out. By the public law, there are 6 categories that these municipal tax revenues must be spent, can only be spent in, and that is, and these are the words from the, oh, you got it, great. So these are the words from the legislation. And whether or how the state legislators thought deeply through all of this, and created titled areas that are watertight or bulletproof in what they can be spent on. Here's what they are, and I'll just read it for anybody who's on the move, on the road or anything. Number 1 is streetscape or neighborhood improvements. Number 2 is education programs and or youth employment. Number 3 is Department of Corrections exiting support, parole, or probation. Number 4 is mental health and or addiction services. Number 5 is the Youth Service Bureau and or the Juvenile Review Board. And number 6 is community civic engagement efforts. Those are short titles for, 1 or 2 sentences in the legislation for how those things can be spent. Kate and I had a meeting with the city manager. We understand that as we move towards April and start to plan the next budget year, we want to be smart about where we're spending those monies. And so if this committee sees things that should be discussed or considered, I think that's partly what you guys are formed to do. So my job here is done. I've laid all this out for you. It's time for us to make sure that, ever since I started chasing down the cultivators and retailers, I've been saying to everyone, I want us to bring the industry here for the economic value and the jobs that it's going to create, which is about 120 for the aggregate cannabis operators, growers, and sellers that we've got right now. But I want to make sure we do it with the tag title over the top of it, responsible cannabis. Much like for those of you that have been in and around the gaming environment, responsible gaming. There's an entire responsible gaming commission and council that exists. I think responsible cannabis is a subset of what you guys are doing for that. Like,
Can I ask you a question? Are there a limited number of, is it sort of like liquor where there's only a certain number of licenses allowed in each community?
What a great question that there's not a simple answer for. So one of the reasons we as a city engaged quickly is I noticed how many towns up and down the shoreline were saying not here, not here, not here. And I thought, we got to do this. We have got to advantage ourselves. There is no state mandate or edict for how many. It's been left to communities to decide. We, as a city, have not yet put a cap on, which is one of the things that made Norwich attractive, but we also haven't blown it out. We've only got one so far. I believe we will land a second, and I think, never mind a municipal policy that might say no more, I just don't think the market will bear a third one. Or if it does, that'd be it. So we have one opening Friday. We might get a second. We will probably get a second one. And then I think we should all just stay tuned to see how things evolve, how the market evolves, how the social impacts evolve, and see if there might be a third.
The reason I asked was when we went to the meeting, we had one meeting in Montville with Ron McDaniel, and he said, look, we're in the area right now. So the money we're getting isn't going to be the same money we're going to get in a year. But how do we leverage what we're getting now? And then what do we anticipate going forward? And, I assume it's going to be the same discussion here, but will there be competition? Because obviously each city benefits from having their places do well.
Right.
There's going to be cities that are going to be trying to assist more. So
Yeah.
when you talk about your role, are you trying to grow the ones that are here and put the other ones out? I wouldn't say put the other ones out of business, but you know what I'm saying? Like,
Yeah, I mean, look,
funnel people. Why would I go to your best place over that one?
so Ron McDaniel's approach was spot on. He's being smart about it. We should think that same way that, there's going to be some period of looky-loos. People want to come in, see what it's all about, and then they disappear. And the market will level out. But let the numbers drive this conversation, at least for the time being. There has only been January is when recreational retail sales began. And there has only been month-over-month growth the first 6 months of this calendar year. And I suspect it will grow a little bit more as more facilities come online. And then between the looky-loos leaving and the market balancing itself out, it's going to drop down. That's why, as I opened up on the dollars and cents side of it, I said, 122 million could mean as much as 700,000 per municipality with the retail. I said, my conservative estimate is 312,500. That's where I'm at right now. I'm saying we should think in the 312, and that's times that is 12 million or whatever, but at 300, a little over 300,000 is probably what we're going to ultimately have this year, or what we should probably conservatively estimate this year, that we might carve into these 6 categories for spend.
It's a really tough thing for me to wrap my brain around because my first job in public health was tobacco control. And in Massachusetts, our goal was to go smoke free. So the settlement money was used to provide programs that would get people to stop smoking completely.
Right.
So to get funding from a program that seems like it's attempting to have sustainable funding for a program that, from a public health perspective, I may choose to say I don't like it at all. And, here it's hard for me to support something that I'm running programs to counteract the results of them having these programs. It becomes a little bit difficult for me as a health director to support it.
Patrick, I will not challenge you on public health, not one bit,
Yeah.
but I get it, we have a casino down the road that does $1 billion in gross gaming revenue a year.
Right.
And it provides a number of dollars to the state to run responsible gaming operations to take care of problem gaming. But the hard metric, truth of the matter is 2% of everybody that walks in that facility is a problem gamer that needs supportive services for them. How does that example I just provided on gaming apply to cannabis? I don't know that I've got that. I don't know if I've got my head wrapped around that either, but I do believe that what the state's trying to do responsibly is say, category 4, mental health and addiction services will account for some number of your $312,000 a year. What are you going to do with it?
Right.
What makes it better from any of the folks in this conversation if I have one more counselor or one more information campaign plus one more counselor, or whatever those right things are that you guys are able to come up with that this money should be spent on.
So, Jose Mohammed, I just had two questions. Do we have data? I mean, this marijuana has been legal in some other states for recreational purposes. Do we have data to support how it has helped health disparities in those states where it is legal? And, do we have a breakdown on demographics? Who are the individuals that use it by age, by race? From the states that already have it legalized, and how has it helped with the disparities? That's one. And then the other impact is that my concern, of course, is and I'm talking objectively from a hospitalist, from a hospital medicine, internal medicine perspective, that in elderly, it increases confusion and dementia. So, for me, yes, it is legal and that it brings revenue, but it kind of goes along like, as a physician, would I ever tell somebody, hey, you can smoke because it brings tax money to my city? I just have an issue with it. But I think the main thing is to want to make sure that you get the data to see that in some other states, it has helped reduce the health disparity that exists in our country.
I'm
Is this
just,
something you have access to?
I'm just the economic development guy, and I'm looking to this body, right, to reach out in your professions and your associations to see if you can find out some of those things. What I can tell you, Dr. Qureshi, is for about 7 months now, on my phone in my Safari Explorer, I've had a window that I've kept open, because the first time I tried to dive in and get answers like this for myself, it was from Colorado. And the headline to the article was, experts are split 50-50. So I just put it down. I stopped reading because I thought, okay, if I'm going to find more of this data, I don't need it because it's not been sorted out yet. I don't know that one article demonstrates diligence in trying to figure this out, but it's an anecdotal evidence to answer that question. But look, to your second point, again, that this is why I'm dropping this mess in front of you all for this conference, because each of you has important points of view about this that we need, that if we as a city of Norwich are going to demonstrate we're doing things responsibly. I mean, this is going to sound very rote, I suppose, but if we do nothing else, we collectively should have an information campaign that says, hey, Norwich made it legal, but here's what you need to know. Children under 18's brains can be malformed, or I'll use all the wrong words because I'm not the doctor, right? But it's not good for you. It's not good for elderly patients who are experiencing or en route to dementia. It's not good. Here's a statement of the obvious. If you are working in a factory and you're going to work high, there's an HRO, there's an HR part of this conversation to be had. I am not the arbiter of all of these different facets and professions that I'm showing, but I'm dropping it for you guys.
So I used to be on the National Association of City and County Health Officers Disability Committee, and one of the things that we looked at was we can't do all things, it's too big. So what we agreed to was we would look at any policies that were put in place at the national level, funding streams, all from the guys or from the viewpoint of disability. And we would at least provide input on those areas. So that way we could at least say we reviewed it and we provided some input. And maybe as a committee, that's what we agreed to, is that, any policies that are affecting the city, any marketing materials that are affecting the city, we can pick the categories, but maybe that's what the role of the committee is initially, is just to at least say we're going to review it as part of our work, and we'll provide some feedback from our different perspectives, and we'd be happy to do it in a timely manner. It may just be something like that initially.
And just to get some clarification, so the people who have applied to be cultivators or retail, there isn't responsibility on that for that messaging, that marketing.
There is not direct.
And what about the municipality who accepts it in? Is there responsibility on that?
No, No, but that's what I'm.
No,
trying
no,
to
no,
do.
I see
We
where you're
gotta
going.
do
I'm
something,
just
yeah.
trying to figure out if like where else that's
It's
happening.
mandated or.
Correct, because
yeah.
we see a lot of times when a new business comes in,
Yeah.
there's some responsibility that's allocated, especially if it's, governed by certain regulatory bodies.
Yep.
So in this case, there is no regulatory
Yeah, but you
criteria.
know
or
what, Joe, I'm gonna
responsibilities.
I'm gonna check myself on that to make sure that I'm accurate. What I know to be true, because it's been put in front of
Okay.
us a few times now, is their workforce development and social equity plans.
Yeah.
But I don't think I've read through 3 of them now, and I don't remember any of them having a sub bullet that said.
Especially
"Conduct
language
effective
around children
information
and
campaign."
families,
Yeah, yeah,
things like
yeah,
that.
right,
Like, I
right,
wonder what that is. I'd like to see all of that in terms before we decide, as a committee, what we're doing,
Right.
because I would hate to reinvent the wheel. And I would hate to have this committee spend a lot of time working on something that is the responsibility of another party.
Yeah.
By all means, everything that you said, Kevin, in terms of this committee being robust and experts in their field is correct.
Mhm.
However, we have to make sure that we're putting those resources in appropriate places so
Yeah.
that we're not duplicating those services.
I agree. And somehow as we merge this whole conversation, Joe, I think this, I'm a dollars and cents guy. This spreadsheet of potential uses is gonna either drive or contain this conversation appropriately. If the city of Norwich ultimately in fiscal year end 2024 gets $18,500 for community civic engagement, we can reverse engineer and say, well, all we can do with this is put flyers up in the schools. Whatever that thing is, these are all the folks who put that up.
Can I just say one thing? So, I think obviously all of our healthcare, those of us in healthcare, the issue of whether it's to one's health advantage to smoke cannabis and, or drink alcohol or gamble or any of these things that are potentially addictive behaviors. But I think the role of this committee is around health equity specifically, not around health in general.
Correct.
So that I think we have to be very focused about, and that's when you raise the issue of marketing. I'd be interested to know, is this product being marketed differently to attract a disproportionately Black population or disproportionately Hispanic population? I mean, that's the thing that I think we should be concerned about, is how the product is being marketed, maneuvered, whatever, to create addiction inequities within the population that we serve. So I just wanted to kind of carve it up a little bit smaller.
I appreciate that, Jen, because I probably was opening the aperture bigger than it's supposed to be. However, the interesting thing, the irony of what you asked or presented there is the fact that the state knows the answer to your question, because the state said, we're going to put these things in disproportionately impacted areas.
Mhm.
So we know the answer. The answer is yes.
Is racism at the base of this from that standpoint? Are they marketing it to Black and brown people? You darn right they are.
Mm.
Okay.
Mm.
And
If for no other reason, geography, like where the places are that.
right, I mean, if you look at how that committee got set up, it is set up, and where are they, and who are the towns that are saying we don't want it? And what are the towns who are taking it? And nothing against you, Kevin, but no,
that's why
just
I'm here.
taking it because we need tax revenue. If we didn't need the revenue, me and some other people would have told Kevin, go bye-bye, go take it someplace else. We need the revenue, so don't be stupid about it. They passed it, it's here. And I think for me, in the brain it is though, how do we really help it? We're gonna get this revenue back in, and don't take this wrong, Kevin, to your industry. Jen, don't take this wrong to even the services you provide for people who have addictions. I still don't believe that we really put the emphasis as a state to address it. We put the money there. We let people put out programs, or we let people put out surveys or whatever, and we're not getting to the root of the issue, is how are we really addressing it? And I don't think the state wants us to really address it. But I would like to think this committee, if we developed a comprehensive way of doing it, would be it wouldn't be called responsible cannabis. We'd call it something different, okay? And really then address it. And then I'll take for Kate, for you and Jen and Patrick, you may have been involved. When we really did, let's end homelessness in 10 years. And there was a real concerted effort, and there was a game plan, and there was, you know, people brought into it. It has to be that kind of project for me, okay?
And thank you, Jen, for making sure that we're steered in the right way, because I would say that that would be the guiding principle that we look at with all of these opportunities, is really looking at the health equity aspect of where we're going with this.
Right, and how does it align with the articulated goals that are in the statement that we were just talking about? Because I don't think our job is to just, I don't know, just study it or something like that. You know, I don't know. I always laugh because within, you know, I could walk across the street and buy a handgun, alcohol, edibles, like we're all within like a little triangle.
I laugh at two retailers when there's package stores coming up as fast as auto parts places.
Yeah.
So it's
Yeah.
like,
I'm here to inform. I wanted to share all that information and, you know, look, again, probably the fine point is there are going to be monies to be spent in the right places. And even if all I did was, you know, point you at the fact that maybe there's dollars there for a good program or reason that you can get it. Now we all are on the same page.
well, I think the whole committee is very interested to hear from you about what the regulatory requirements are from that perspective. And once we see that, we may be able to better sort of look at what we might be able to do in terms of addressing that health equity. We just want to make sure that we get a sort of level set lay of the land. So if you wouldn't mind sharing that with us, that would be great.
Will do.
Any other questions for Kevin? Thank you so much for joining us
Thanks,
today. I
guys. I'm gonna
appreciate it.
step out.
Yep. So I know we're a little over the agenda. But I think I can move through this pretty quickly. So if everyone can stay on for just a couple of minutes, we won't have to revisit these agenda points. So mission and vision. We do need a mission and a vision. And I know most of you on the call are aware of that. We'd like to solicit feedback from committee members about mission and vision language. So if you wouldn't mind sending some phrases, some ideas about this committee to Sheila, we'll try to craft a mission and a vision. Now that we're actually starting to move, we need to make sure that we can represent this committee to the best of our ability. So that would be a good statement for us to sort of become a little bit more official. So we're asking that you solicit that feedback to Sheila before the next meeting, and then we can share that and sort of work on that together. 6 areas of focus. So I was not in the meeting when these were developed, but we need to have members be assigned to each one of these committee members. I was going to take some time and ask for volunteers and then assign, but because we are over, I will leave it up to you folks to pick 1 or 2 or all of them if you so wish, and let Sheila know which ones you're going to serve on. We need to have everyone on committees, so we will move forward with that. So please volunteer, let Sheila know which ones you want to go in. And then agenda number 8, other business. The membership status of Miss Erica Brennan. We had mentioned that if a certain member was not in communication with the committee, had missed 3 consecutive meetings, that we would then send paperwork that her position on the committee was no longer valid. So we're bringing that up to the committee to move forward. So I will entertain a motion.
Can I just ask, just for clarification, is she represent an agency or was she representing herself?
She was representing Rose City United.
Rose City United,
Which
which
is-
was not a, it was not a formal committee, it was.
So it's nobody, we don't have to notify the CEO of an
No,
organization or
it's
something.
sort of a defunct organization. It's not even her fault. I don't think that she couldn't make the meetings. We just need, in order to make a space. we
I
need
just
be
wanted to
able
make sure if she had a supervisor or somebody else, we acknowledge them too in case.
So I'll make a motion to formally send a letter of resignation,
Termination.
of termination. That's good. Of termination to Miss Erica Brennan for her role on the Health Equity Committee.
This is Patrick McCormick, I'll make a motion.
Second, please.
Second, Mohammed Qureshi.
Qureshi. Roll call, Jen,
Aye.
Dr. Qureshi,
Aye.
Laura,
Aye.
Chief Daly,
Aye.
Kate,
Aye.
Patrick,
Aye.
Sheila,
Aye.
Joe Zuzel, aye. Motion passes unanimously. Any other further comments or discussions? Hearing none, I'll entertain a motion for adjournment.
It's Patrick, I'll make a motion to adjourn.
Patrick motions a second, please.
Kate, I'll second.
8 seconds. Jen,
Well, aye.
Dr. Qureshi,
Aye.
Laura,
Aye.
Chief Daly,
Aye.
Kate,
Aye, sorry.
Patrick,
Aye.
Sheila,
Aye.
Joe Zuzel, aye. We are adjourned.